Every year, about 3 million seniors end up in an American ER from a fall. The CDC confirms that number. In 2024, more than 43,000 older adults died from a fall. Some of those falls happen on the morning walk your doctor told you to take. And there's a document from the American Heart Association published January 2024 that explains why. I'm Dr. Henry. Today we're looking at something almost nobody connects: the blood pressure pill you swallow with breakfast, the walk you take right after, and a 30-second window in between where your body can't protect you the way it used to. This is educational. Always talk to your doctor before changing anything. Stay with me on this one. The finding in the AHA statement will change how you step out your front door tomorrow morning. What actually breaks down after 60? When a younger person stands up, blood rushes to the feet. Pressure sensors in the neck, called baroreceptors, catch that within a second. The heart speeds up. Blood vessels tighten. Pressure stays even. You feel nothing. After 60, that whole system gets slower. The sensors lose sensitivity. Arteries stiffen. Dr. Louis Lipsitz, a Harvard geriatrician at Hebrew Senior Life's Marcus Institute for Aging Research, has spent over 40 years studying this. 300+ published papers. He's shown the aging baroreflex is one of the biggest reasons older adults fall. Now stack a blood pressure pill on top of an already sluggish system. That's the setup. The 2024 AHA document nobody reads. January 2024. The American Heart Association publishes a scientific statement. The title is Orthostatic Hypotension in Adults with Hypertension. Lead author: Dr. Stephen Jurashek, Harvard Medical School, Beth Israel Deaconess Medical Center. Journal: Hypertension, Volume 81, Issue 3. Here's what the statement says in plain English. Orthostatic hypertension is a drop of at least 20 points in your top blood pressure number within 3 minutes of standing up. Among adults over 65, as many as 1 in 3 have it. Among seniors in nursing homes, it's closer to 1 in 2, 1 in 3. And those first 3 minutes of standing are exactly when you start your morning walk. You roll out of bed, you swallow the pill with a glass of water, you lace up your sneakers, you step out the door. By minute 3, your blood pressure is at its lowest point of the day, and you're on the sidewalk. The AHA statement also says something your pharmacist may not have told you. Orthostatic hypotension is an independent risk factor for falls, dementia, and early death. It isn't just a dizzy spell, it's a signal. The AHA document is free. I'll drop the link in the pinned comment. The 4 pills that don't act alike. Here's where label forensics matters. Not every blood pressure pill carries the same risk. Alpha blockers, doxazosine, terazosin. The AHA 2024 statement flags these as peripheral vasodilators that can worsen the drop in pressure when you stand. Beta blockers, metoprolol, atenolol, carvedilol. These slow the heart. When you stand and your body needs the heart to beat faster to catch up, it can't. You feel lightheaded before you've taken 10 steps. Diuretics, furosemide, hydrochlorothiazide. Water pills. They shrink blood volume. Less fluid in the pipes means less pressure when you stand, especially if you took the pill late in the day. And then ACE inhibitors and ARBs. Lisinopril, losartan. The AHA statement says agents that don't aggressively vasodilate tend to be less likely to unmask orthostatic drops. Same diagnosis. 4 very different profiles. The label doesn't disclose which risk bucket your prescription falls into. You have to ask. The 15-day window nobody warns you about. In 2016, Dr. Daichi Shimbo at Columbia University Medical Center pulled records on 90,127 Medicare patients 65 and older. Every one of them had a serious fall injury. Shimbo wanted to know what happened right before the fall. Here's what he found. Starting a new blood pressure pill, or adding a second one, or raising the dose. Each one of those events spiked the risk of a serious fall in the 15 days that followed. A serious fall, hip fracture, head injury, brain bleed. The paper ran in Circulation, Cardiovascular Quality and Outcomes, Volume 9, 2016. That 15-day window is an invisible danger zone. You don't feel different. Your doctor doesn't call to check. The pharmacist hands you the new bottle and says, "Have a nice day." And the risk clock starts. Then, January 2026, Shimbo's team published a follow-up in Hypertension, Kaiser Permanente, Southern California, 630 seniors. They looked at the gap between blood pressure measured in the clinic and blood pressure measured at home on a 24-hour monitor. Seniors whose home pressure ran well below their clinic pressure were the ones walking around with an invisible risk nobody at the office visit could see. The Harvard Standing Reading. Back to Dr. Lipsitz. In 2013, he published a clinical review in JAMA, the case of a 91-year-old woman with difficult-to-control hypertension. The piece came out of a grand rounds he gave at Beth Israel Deaconess. His core message: the same aging body that sits with high blood pressure often has pressure that crashes the moment they stand. One condition hides the other. Treating one can worsen the other. His recommendation: get a lying down and standing up blood pressure reading. Not once. Every time the medication changes. Most seniors have never had a standing reading taken in their lives. You've probably only seen a sitting number on your chart. That's half the picture. The dangerous half is usually missing. Your pre-walk safety check. So here's what you can do tomorrow morning. This isn't medical advice. This is a conversation to have with your doctor. 1. At your next appointment, ask for a sitting and a standing blood pressure reading 3 minutes apart. Write both numbers down yourself. 2. Ask your pharmacist one question. Is my blood pressure pill in a class that raises my risk of a drop when I stand? They know. They'll tell you. 3. Before your morning walk, sit on the edge of the bed for 30 seconds. Stand still for another 30 seconds. Then walk. Half a minute of patience. 4. If your doctor recently started a new pill or changed your dose, the first 15 days are your highest risk window. Walk with someone. Walk shorter, walk slower. The AHA statement, the Columbia study, the Harvard review, it's all public. Links in the pinned comment. One more thing I keep coming back to. If you take a statin for cholesterol, it's quietly depleting a nutrient your heart needs every day you swallow it. That's the next investigation. I'm Dr. Henry. Stay informed and stay blessed.